Welcome to KidzDocTalk with Dr. Jennie. Today's guest is Dr. Mark Sawyer. Dr. Sawyer is a professor of clinical pediatrics and a Pediatric Infectious Disease Specialist at the UCSD School of Medicine and Rady Children's Hospital in San Diego. He's the medical director of the UCSD San Diego Immunization Partnership, a contract with the San Diego County Agency for Health and Human Services to improve immunization delivery in San Diego. He's a past member of the American Academy of Pediatrics Committee on Infectious Diseases, the FDA Vaccine and Related Biological Product Advisory Committee, and the CDC Advisory Committee on Immunization Practices. He's also the associate editor of the AAP Red Book. Recently, he was recalled to the VRBPAC to work on the FDA approval for COVID vaccines. Welcome, Dr. Sawyer.
Welcome to KidzDocTalk with Dr. Jennie. Dr. Jennie is a board-certified pediatrician and is the director of telemedicine at Pediatric Associates.
Good afternoon, Dr. Sawyer. Thank you so much for joining us today.
Good afternoon. It's great to join you.
So I'm excited to talk about this, and specifically excited to talk about it with you since you're in a different part of the country than the specialists I usually speak to. So I'm curious of what your insight and experience has been during this pandemic. I want to start out by asking, what are we seeing right now with current trends in COVID infections? I feel like a lot of times we think we're in a surge, and the question is always like, are we surging? Is this the peak? Are there a lot of cases right now? What are you seeing, and what has your experience been?
Well, Omicron has been really surprising, and it's peaking everywhere. It's peaking here in California. I'm sure it's peaking where you are. It's peaking all around the world. So we are seeing more cases in children. But one of the reasons for that is that children, at least very young children, can't be immunized yet. So they're all 100% vulnerable to the infection. And we have learned that Omicron is incredibly contagious. So once it gets into a household or any other group setting, it's going to spread from one person to the next.
So since you mentioned that as sort of a reason that we're peaking right now, other than the fact that it seems to be very contagious, any other key differences that we're seeing with the Omicron variant?
Well, the good news is it seems to be less severe in terms of the disease that it causes. Now, I think people are generally familiar that children, compared to adults, have milder disease, which is good news. And that's true for Omicron as well. They have milder disease than adults, particularly adults with high risk factors. But there are some kids who still get severely ill. So it's not something we can ignore.
A lot of times I find that when we hear of a child who has severe disease, or a child who has been hospitalized, one of the questions that always comes up, and maybe not even just for children, but in general, I feel like the question people want to ask is, well, what underlying conditions did they have, right? And I know sometimes we have an answer to that, and sometimes the answer is they didn't have any. But are there certain trends that you think we can sort of predict that someone is probably, right, an increased likelihood or increased risk of developing severe disease, developing either significant sequela, MIS-C, ending up in the hospital? What things should we look for, and how much can we rely on those as being accurate ways of predicting it?
Well, certainly there are underlying conditions that put you at increased risk. That's true for adults. It's true for kids. Some of them are obvious. If you have an immunocompromising condition, such as a cancer, and you're on treatment for that, or some of the other treatments we use to suppress the immune system for rheumatologic diseases or things like that, then you're certainly at increased risk. Young children under a year of age are generally at increased risk for most infections, so that's true for COVID as well. But there are some less predictable things. Obesity, for example, turns out to be a major risk factor. And unfortunately, we have even more obese children now than we did before COVID, because everyone's been sitting around playing video games instead of going outdoors and exercising in group activities. So that's one to keep an eye on. Asthma or any other underlying lung or heart condition, diabetes, those sorts of things also increase risk. So parents who have kids with any of those conditions need to, double down on the measures that we have to try to prevent infection.
I find that one of the reasons that parents may be a little bit hesitant to pursue vaccination in kids who are eligible is when they do have underlying diseases, like they say, my child is an asthmatic, and so I'm nervous to vaccinate them. I always feel like those families should be extra cautious and should be kind of on the right first in line to be vaccinated. Would you think that was that your opinion as well? That those are really kids that we should be focused on vaccinating?
It's exactly the opposite, as you say. Those are the people who really need the vaccine, and everyone in their household needs to be vaccinated. So even if they have healthy siblings or young adults, parents who don't feel that they're personally at risk, they are at risk for picking up the infection, bringing it home, and giving it to their high-risk child. So there are no unusual or different side effects from the vaccine in kids with underlying conditions than there are in anybody else.
I think that's really critical. I've heard people say, when kids get COVID, the whole household, right? They bring COVID into the whole household. So I think that's really important to focus on, not only immunizing them, but their caregivers and close adult contacts as well.
That's especially true with Omicron. It's so contagious that even if you try to isolate in a house, it's almost impossible to stay away from each other well enough to prevent transmission.
So let's talk a little bit about isolation, because as you mentioned, obviously now it seems to be more challenging, or maybe not as helpful, but I have found it to be uniquely challenging when kids are sick to encourage family members to isolate and to mask. How helpful is it? How much should we still be focusing on that when we have a family member who's been exposed or infected?
Well, pretty much like everything with COVID, it's a risk-benefit analysis. So if you've got somebody in your house who's extremely high risk, let's say they have cancer and they're on therapy, you need to do everything you can to prevent transmission to that person. And so that may mean parents, sleeping in a different room than they normally do, only one parent taking care of a child instead of both, siblings not interacting with their brothers or sisters during that period of potential contagiousness. On the other hand, if you're a completely healthy household, then you maybe don't have to go as far as that. But I think we should all try to prevent transmission when we can, which is keeping in mind masking when in close contact. If we know the family's been exposed, you can ramp up your protection for those couple of weeks and then go back to normal if nothing happens.
So how about strategies, using those same strategies, but to help reduce the risk of transmission, right? So the common time this comes up is activities for kids, specifically school for kids, right? How much should we really be focusing on masking and distancing? Do we know at this point, right? It's been 2 years into the pandemic. I imagine we have some evidence that this is either helpful or it's not.
It is helpful. Masking for sure is helpful. We know that it works. One piece of evidence for that is there are not COVID infections being transmitted in hospitals or doctors' offices from the people who work there to their patients and vice versa. And the main thing that we do in hospitals and doctors' offices is wear a mask properly all the time. And so clearly masks work. They don't work as well for Omicron as they did for other strains because it's more contagious. They certainly don't work if you don't wear it right. So if your nose is sticking out above the mask, you might as well not have the mask on. That's not really doing anything. And we've learned that the hospital grade masks and so-called N95 or KN95 masks work better than cloth masks. They may be a little less comfortable, so a lot of people aren't using them, but they're more effective. The other thing that people don't remember is that ventilation is a key thing to keep Omicron or any COVID strain from spreading. So if you're in a climate that allows you to have the windows open or spend more time outdoors, that's another thing you can do to prevent transmission.
So I get a lot of questions about outdoor transmissions and how comfortable can we be for kids to have outdoor interactions where they're reasonably distanced and be unmasked. So examples are, for example, sports activities, right? Playgrounds. I haven't seen a ton of evidence regarding outdoor transmission, so I've mostly felt comfortable having those situations be unmasked. Is that still true with Omicron?
It's probably less true with Omicron, but I think most people still think that is true. There are not large outbreaks that are attributed to outdoor gatherings. Certainly, if you also maintain some distance between kids in the park or playing with each other, if you can come up with something for them to play that they don't have to be right in each other's face, then I think you're safe outdoors without a mask.
Okay, so that's reassuring. So, the key strategies, right? We have masking, we have distancing, and now thankfully we have the vaccine. So let's talk a little bit about that. What are the current trends in COVID vaccines in children? What percentage of the country's eligible children are vaccinated, do you think?
Well, it depends on the age. We're doing really well with older teenagers and even the 12 and above. The last numbers I saw, we were at somewhere around 60% or 70% of those kids getting immunized. We're not doing so well in the 5 to 11-year-old age group. Now, they only recently became eligible for vaccine, I think around the beginning of November. But we're sitting at 20 to 30% nationally with that coverage rate. So we have a long way to go for those younger kids.
So you mentioned with COVID, everything is a risk benefit analysis, and that's kind of how I've been approaching it as well. So let's talk a little bit about the risks and benefits of the vaccine. What can we be telling patients? How can we be reassuring them that the benefits really outweigh the risks?
Yeah, well, let's start with the benefit side. Despite everything you read that says the vaccines are not as effective for Omicron as they were for previous strains, that is true. But they're still effective, meaning they're particularly still effective at keeping you from getting really sick. So you don't end up in the hospital, you don't die of COVID if you've been immunized. And that's true in adults and in kids. We've seen that clearly, and that's also true with Omicron. So that's the benefit. It keeps you from getting really sick. With Omicron, unfortunately, they don't do as well at preventing all infection. In other words, minor infection or even infection without any symptoms. So we can't say as much as we used to that it will help decrease transmission because you still can get infected and transmit it to somebody else. But still, the benefit is large. The risk is, been talked about a lot, but I would argue the risk is actually quite low. Let me just talk in general terms first. We have given literally billions with a B, billions of doses of COVID vaccines around the world. We've given millions of doses to children, including 5 to 11-year-old. I think the latest figure I saw was 7 or 8 million 5 to 11-year-olds have been immunized. So we know exactly what the side effects are. People who are holding out because they're worried that the vaccines are new or that somehow they haven't been studied enough, aren't really recognizing that point. If we've given it to millions of people, we would know what unusual side effects are going to happen. And there are side effects, but we know what they are. And the main one parents should know about, and they're going to read the most about, is myocarditis. So that's an inflammation of your heart muscle that has been seen with the mRNA vaccines, and it occurs in children and adults. It's more severe, or it's more likely to happen in males compared to females, and it's more likely to happen in young adults and older teenagers, say 16 and above, than it is in teenagers 12 to 15, and it's even less common in 5 to 11-year-olds. So kids in elementary school are at very low risk. And by low risk, I'm talking a few cases per million doses of vaccine. So in your community, if you have 1 or 2 million people living there, there's going to be a handful of cases of myocarditis from the vaccine. In contrast, there are going to be more cases of heart inflammation caused by COVID infection. So once again, if you look at the risk benefit, the benefit of the vaccine in preventing infection outweighs the risk of the vaccine, which is low.
I think that's a really important point, that the risk of myocarditis from COVID, from the infection, is higher than the risk of it, of getting it from the vaccine. And I think for some reason, there's just a lot of focus on that being a side effect of the vaccine. And I can understand why. but there's probably not enough talk about how it's a pretty significant side effect of the infection itself. And one thing that I really just want to hone in on is that you mentioned vaccine protecting against severe disease. I find that people probably don't think about it that way. They think like, I'm vaccinated, so if I am sick, right, or if my child is vaccinated and then they get sick, the vaccine failed me. And that's really not the case, right? The point of the vaccine, our goal is not to prevent mild disease. It's not to necessarily even prevent exposure, but it's really to prevent severe disease, to prevent hospitalizations. That's ultimately like the way that we hope the pandemic will end, right?
Yeah, I mean, it would be great if the vaccines prevented all disease the way measles vaccine does. But, we have other vaccines that aren't perfect. In other words, they don't prevent all infection, like influenza vaccine. We use that all the time. We see value in that because for the same reason, that it generally prevents severe disease. And for sure, that's our target for COVID. The reason communities are locking down and restrictions are being put in place are primarily because the hospital systems get overloaded. So if we can prevent severe disease, the hospitals won't be overloaded. We're not going to get rid of COVID with the vaccines. We're going to have to live with it for the foreseeable future. But as long as we don't overload our health systems and we can protect the most vulnerable, then we can go back to business as usual.
So since you mentioned the flu vaccine, I think a lot of people make that comparison. And the thing with the flu vaccine is that we get a new one every year. So is that sort of what you think we should expect with the COVID vaccine, especially for kids, right? Right now in adults, we know there's boosters and there's a population that boosters are recommended for. But with kids, is that kind of where we're looking at, where there's going to be a booster, either a third shot or an annual shot, the way that the flu vaccine is?
I'm pretty sure, based on what we've seen so far, that boosters are going to be part of the equation, at least for kids who have high risk conditions, because the immunity wears off to some extent over time. It's still protective months later, but it's not as protective. So for kids who have high risk conditions, we're probably going to come up with a booster at down to age 5 or maybe even lower than that. The real question is whether we need version 2.0 vaccines that are changed and updated to reflect the current strains. The companies are working on those vaccines, but I think it's a little early to predict whether we really need those vaccines because, as I've said, the current vaccines still work. They still keep you out of the hospital. They keep you from dying. So it's going to be a balance between the effort and expense that it would take to re-immunize everybody every year with a new version versus, what happens on the ground with COVID as an infection. It may not turn out to be as severe as influenza in terms of how prominent it is in our communities. Or on the other hand, it may stay like it is, which is a big problem, in which case then we're going to have to use yearly or some other frequency of vaccination.
That makes sense. So let's talk about a population that is unfortunately still very vulnerable to infection, which are those kids who are not eligible for vaccination yet, not old enough to be vaccinated. I get a lot of questions on when are they going to be eligible? And I think there's a lot of conflicting data. Initially studies, right, look like they didn't really have good data to show that the doses they were using were helpful or protective in this age group. What is your insight on this? When are the younger kids going to be vaccinated? What is the full age group that we should expect, and any timeline?
Yeah, let me start by clarifying what we know so far. The companies are studying the vaccines all the way down to 6 months of age. And so we are going to have information very soon on this point. The issue you brought up about the first study in children at least 2 to 5 years of age didn't work as well as they expected. It did still work, but it didn't achieve the level of protection that we were striving for. So they have given those same children a third dose. Mm-hmm. So 1, 2, 3 doses, and we're waiting for that data. And my understanding is that's going to be coming forward in the next month or 2 at the latest. So I think you'll have information on whether we can immunize at least down to age 2 within a couple of months. I'm not sure quite how long it'll take us to get all the way down to 6 months. And it's there's so many things changing at a time that it's a little hard to predict, because it will depend on what Omicron does and whether we get any other variants that further challenge the vaccines. But I am optimistic that we will get there and we'll be able to protect younger kids as well.
But that's reassuring. That's reassuring. I have a 5-month-old, so we are anxiously awaiting his vaccination eligibility, and I know many of my patients are as well. So as somebody who's been kind of watching this unfold over the last almost 2 years now, any main takeaways, anything that you really just want to kind of be the main message for parents who are anxious during a pandemic?
Yeah, I think that the biggest message is that you can be comfortable that we understand these vaccines very well. So, we wouldn't be recommending them routinely to all children if we were concerned about the side effects. That, pediatricians are not in the business of recommending something that isn't good for children. So you can be reassured that this has been thought through very carefully and the vaccines work. I mean, no doubt COVID has been a slap in the face for all of us. Nobody predicted we would ever have an infectious disease that has caused this much trouble. But on the other hand, it's miraculous how quickly we've developed vaccines and antiviral medications and antibody treatments. Just in 2 years, we've done what in previous times took 10 years to do. So I'm really optimistic that we'll get better and better vaccines, better and better medications. We may learn more about how to control it in the environment. I can see the ventilation being turned up in all interior buildings where people are spending time to try to spread out the air. So I think we can be optimistic. I think we're over the worst of it now that Omicron has swept through the country. I think we'll settle back down to the way we were this fall, sort of living, coexisting with COVID as a problem, getting vaccinated to protect ourselves, but then going back to school and sports and all the other activities that kids like to do.
Wonderful. I like the optimism, and I hope you're right. I look forward to seeing things settle down a little bit soon. Well, I want to thank you so much for your time. This has been so helpful. I've learned a lot, and I really appreciate it.
Great. It's been fun chatting.
Thank you.
Make sure you like us on Facebook and follow us on Instagram and Twitter. Thank you for joining us on KidzDocTalk.